Welcome to @Cronkite News, your social sharing connection where you choose the news. Facebook likes and shares, tweets, retweets, and favorites. YouTube views and subscriptions. We're watching you, watch us. From our digital home at cronkitenews.azpbs.org to your television, web browser, or mobile device. Let's get a refresh on the top Arizona news of the week.
Tonight, Cronkite News continues our commitment to covering Arizona's heroin epidemic. Governor Doug Ducey blames much of the problem on the proliferation of prescription drugs.
Cronkite News investigative reporter Ty Scholes looked into the medical data behind these dangerous drugs.
Cronkite News has been tracking heroin's hold on Arizona since last year, but even more people are having deadly encounters with prescription drugs, landing them in emergency rooms across the state.
Brittany Pinkston was prescribed Percocet by an urgent care doctor after a hand injury.
The very first one I took, it was the best thing of my life. And I literally said, I'm going to do this every day for the rest of my life.
Within a month, she was hooked.
For over a year, I did it a lot. Because if I couldn't find any on the streets, I could easily go to urgent care and they'd prescribe them to me in a second. I knew exactly what to say. You just go in and say my back hurts and they'll give you a Percocet. I got one in the waiting room once.
It happens all the time.
So if you look at the United States, we actually represent only 5% of the world's population, and we represent 80% of the prescription drugs.
State records show that 1,052 people required emergency treatment for prescription opiate overdoses in 2014, up from 1,018 in the previous year. Heroin overdoses also continue to increase from more than 521 in 2013 to 605 in 2014.
Most drug abuse, specifically in the heroin arena, starts by using legal prescription drugs, 75% in fact. So if we can identify individuals up front who are at risk of becoming addicted, we can intervene and help them and save lives.
Dr. Dan Kwan at Maricopa Integrated Health System sees overdoses every single day.
I had one patient that said he was hurt at age 8, and that's how he got addicted to pain medication. He didn't know any better because he was so young, so he just kept escalating from there.
Nick Sanders was a pill addict too. Like many teens, he got his first pills from a friend.
When I first got high on it, I mean, it really felt like, the heavens had parted and I'd found, what I should be doing finally, like I was always anxious.
Former addicts tell Cronkite News they did whatever it took to get the drugs. Doctor shopping, even armed robbery.
But the funny thing is you think you're not that bad until you can't get the doctor to prescribe you pills. And then you're like, holy shit, this is a problem.
Sanders robbed a Walgreens.
I flashed him the gun real quick, he hands me the pills, and I pretty much just walk out the fire exit.
Arizona legislators have a plan to help combat prescription drug abuse. A Senate bill sponsored by John Kavanaugh would require doctors to check a database before prescribing narcotic substances.
In order to save lives and prevent all of the accidents and crime and heartache that follows opioid overdose or intoxication, we're going to mandate it because it just has to be done.
That's the thing. You doctor shop. Any pillhead you talk to, they've doctor shop. That's the point of it. Yeah. Of course you do.
If the bill passes, it would likely be much more difficult to support a habit by doctor shopping. With the investigative team, Ty Scholes, Cronkite News.
A Phoenix teenager is fighting for the right to try experimental life-saving drugs. And he took that fight to the nation's capital today. Cronkite News reporter Wafish Shahid takes us inside the Senate hearing.
When Brophy Preparatory freshman Diego Morris testified about connecting patients to potential life-saving treatments today, it was more than just a hearing.
When I was 11, my family and I had to leave the country and move to London to get a potentially life-saving treatment that wasn't available in the U.S.
That treatment saved Diego's life, but some witnesses are still fighting for their lives. Laura McClynn's testimony about her terminally ill son also hit home for many of those on the Senate committee.
We were here for the speak.
Sure.
Speak.
Because my son has a fatal disease, and so he's in a fight with the clock for his life. And so there is a drug that exists that can slow the progression of the disease that my son has. So we need that drug sooner than later.
The testimony all had a common message: increase access and expedite the process for patients to receive drugs that aren't approved in the U.S.
Have the right to die when we're terminally ill? Fantastic. But what about those who want to fight?
I want to see the process get expedited and give families and patients the opportunity to save their own lives.
Senators were in agreement that this is a bipartisan issue and one that needs more support.
Just to give hope to patients and their families where they have no hope.
This hearing is adjourned.
In Washington, Wafa Shahid, Cronkite News.
Arizona is now in peak flu season and a little later than usual. With more than 5,000 reported cases, Cronkite News reporter Audrey Wheel shows us just how bad flu activity is in Arizona and why it's spreading.
Every week, Walgreens releases a flu index, indicating which states and cities are being hit hardest by the flu. For the past 3 weeks, Arizona has ranked #1 in flu activity, and Phoenix and Tucson now rank 3rd and 4th respectively compared to the rest of the country. Health professionals admit it's hard to say why Arizona is suffering, but there are a few theories.
I don't want them picking something up from someone else, and I don't want them spreading it to anybody else either.
Parents I spoke to at the park today said they always make sure their kids get the flu shot, and experts say it's a good idea for everyone to get vaccinated. Because when it comes to the flu, you just never know.
The only predictable thing about flu is that it's unpredictable.
Some people get the flu and they recover without any medications, without any treatment. Other people get the flu, and sometimes they're young, healthy adults. They'll get the flu and they'll end up in the intensive care units.
In Arizona, incidences of the flu peaked about a month later than usual, just in the last few weeks.
It could just be that physicians or healthcare providers in one part of the country are testing more people for flu, or maybe it's hitting on the West Coast more than the East Coast, but it's really different every year.
Dr. Natasha Bouillon said it could even be an effect of the weather.
So some theories are because the weather is a little bit more warm this year, that's why it's peaking later.
Dr. Bouillon says because of the mild temperatures, people don't have their heaters or air conditioners running, and the air can become stagnant. Another possibility, flu vaccination rates are usually lower in Arizona than the rest of the country. But Sarah Mead isn't taking any chances.
They pick stuff up seriously like every week they're sick with something new. So if there's something that we can avoid, I'd rather do that.
The Department of Health Services says it tracks flu activity from October to September. So even though Arizona is seeing high activity now, cases of the flu can happen any time of the year. Audrey Wheel, Cronkite News.
Customs officers are testing new biometric technology that tracks people leaving the country. Reporter Clara Benitez went to the border crossing in California, where the new technology is now in use.
This new biometric technology is being conducted in 2 phases. The first phase was in December, when non-U.S. citizens entering the country had to provide biometric data. Now the test is in its second phase, tracking all the travelers that leave the U.S.
People leaving the country and entering Mexico at the Otay Mesa pedestrian border crossing now have to go through new biometric screening if they are not U.S. citizens.
The majority of the technology is meant to be minimally intrusive on the traveler, and most processes take anywhere between 1 to 7 seconds, with the longest process probably taking about 10 seconds on the kiosk for a non-U.S. traveler.
The test is part of a congressional mandate to record entries and exits to help track foreigners who might have overstayed their visas. Officers are testing 2 machines. After scanning their immigration document or passport, travelers pause and look at a camera on the wall, which will capture an image of their face and iris. Another machine captures an image of the person's face and iris while they're walking towards Mexico.
I think this is good because that means there is more protection for travelers. It's a personal protection for everyone to prevent identity theft.
Over 9,000 people enter the U.S. daily using this pedestrian crossing. And now with this new technology, U.S. Customs and Border Protection hope to have data on people who are entering into Mexico.
And ultimately, the goal would be to match a person's entry into the United States with their exit from the United States.
All to improve border security and better track those who are entering and leaving the country.
until May of this year, Monday through Friday, 7 a.m. to 10 p.m. All of the data collected will be used for research and evaluations. In the broadcast center, Clara Benitez, Cronkite News.
Slavery is an issue that many think has faded in history.
But for nations across the world, even here in Phoenix, the reality is staggering. Cronkite News reporter Lauren Clark in our Washington bureau talked to an Arizona advocate on the issue.
Well, imagine this heartbreaking scene, a homeless teenager on the streets when someone comes by offering them food, comfort, and shelter, only for them to be used in human trafficking. It's an unfortunate occurrence happening throughout the globe, even in Phoenix, and an advocate named Cindy McCain wants to change it.
It seems strange to even use the term modern-day slavery in our country, but it went from something that I knew next to nothing about to the way that I was forced to live my life for the next 7 years.
Leah was one of 2.4 million people who are victims of human trafficking worldwide. Her testimony and others were heard at a Senate committee hearing. Arizona's Cindy McCain spoke on how the U.S. can be an international leader on this issue.
Even though, we talk about it, we tend to talk about the United States separately from the world. It really isn't separate from the world. Especially when you're talking about labor trafficking coming across the southern border or the northern border as well.
And victims aren't just from foreign countries. Many come from our own neighborhoods.
Violations occur all over the world, and we're no different, I'm sorry to say.
In fact, the Department of Justice has identified Phoenix as a top city for the trade. Those enslaved are often held against their will, forced into labor or sex. People like Evelyn Shumbo. She was brought into America at the age of 10 under the guise of receiving an education. Instead, she worked as a virtual slave.
I was not allowed to sleep on a bed. I had to sleep on the floor.
Evelyn and Leah got out, but for those still enslaved around the globe, there's plenty of work to be done. It's the meaning behind symbols at the hearing, that one day this practice needs to be permanently marked out from the world.
To ensure that my past does not define my future.
And Cindy's work has not gone unnoticed. Just today, she received a special award at the Library of Congress. Live in Washington, Lauren Clark, Cronkite News.
Experts have found a new way to diagnose Lyme disease. Symptoms of the disease, spread by ticks, can often appear to be other syndromes, leading to misdiagnosis. Reporter Lillian Simpson reports DNA sequencing may be the key.
According to the Centers for Disease Control and Prevention, Lyme disease has reached its highest infection rate in years, with about 300,000 reported cases in the U.S. But even that number might be misleading.
We believe that number to be way higher, more around 900,000 due to the misdiagnosis.
Jessica Crawford was initially misdiagnosed, and it almost cost her her life.
I also had joint pain throughout my entire body, muscle stiffness so bad I could hardly take a deep breath, had heart palpitations, and insomnia, chronic fatigue. I mean, it plagues you.
Lyme disease is a tick-borne illness that, if not treated correctly or in due time, can cause severe complications. New York doctor Richard Horowitz treated Crawford and says he has helped more than 12,000 Lyme disease patients from all over the world. He says he's been treating patients from Arizona who were initially misdiagnosed.
And there are people from Arizona who are getting this, who are being forced to go out of state and search for solutions because they just can't find solutions within the medical system here.
However, that could all change in one day. Behind these closed doors, doctors, professors, researchers, and those affected met to raise awareness for Lyme disease. The organization Focus on Lyme and the TGen Research Institute selected some of the top minds in science to meet here in Scottsdale to come up with a solution. A new DNA sequencing method could change the future of how Lyme disease is detected.
So what we're trying to do through applying these next generation sequencing methods to detecting the pathogen and other pathogens that might be co-occurring.
To be able to have for the very first time an accurate diagnostic tool and a tool to be able to show your progress, for you to be able to show specific co-infections, which are a big problem for most Lyme sufferers. It's revolutionary, and it's going to change the face of Lyme disease.
Crawford hopes this will help others get the treatment they need more quickly. In Scottsdale, Lillian Simpson, Cronkite News.
Modern medicine is playing catch up to the smartphone when it comes to patient care, but it's not for a lack of technology. Reporter Ben Brown tells us of a new Senate bill that could enhance telemedicine.
So here's a really good one, nice and brown.
you know, and everything around it looks really good.
Scottsdale dermatologist Richard Averett is conducting a routine skin examination via telemedicine.
I can look at all these other brown spots. I could see what we call the Langerhans lines.
And he would do many more if he were reimbursed for his time.
Could you imagine if we could do 25 or 30,000 telemedicine visits a year because they didn't require brick and mortar?
Then get biopsied. Then he should be biopsied.
The ability to diagnose patients remotely without meeting face-to-face has been around for about 40 years. However, it has yet to become common practice here in Arizona because only doctors who treat patients in rural areas are getting paid for it. If Senate Bill 1363 becomes law, areas like here in Metro Tucson and here in Metro Phoenix, doctors would get paid because patients would be eligible for reimbursement for telemedicine visits. Scottsdale-based Global Med is one of the largest distributors of telemedicine equipment.
Doctors want to be reimbursed. They are small businessmen. If they aren't reimbursed, well, they're not involved in that particular area of a practice. Telemedicine, if it's reimbursed, will become a focus for physicians,
including doctors at the Arizona Burn Center.
It does have its disadvantages, but it is definitely better than a phone call. They say a picture's worth 1,000 words, and I do believe that's true when it comes to telemedicine.
Doctors say telemedicine could save money, time, and most importantly, lives. In Phoenix, Ben Brown, Cronkite News.
The bill unanimously passed the Senate, and the House of Representatives will now look at the measure.
Some northern Arizona officials are taking another fight to Washington, this time over Mojave County's out-of-control burro population. Cronkite News reporter Katie Beery found out how federal law has protected these animals maybe a little too well.
They're cute, slow-moving, and apparently harmless. But as the wild burro population has exploded, they have taken a toll on resources and threatened Arizona motorists.
Nobody has died yet, but they're going to.
That's exactly what brought local county officials to Washington this week. They met with federal officials and Senator John McCain to talk solutions to the problem.
If we're talking about it, then we know about it, and then it's on our hands.
Right now, the burro population sits at more than 4,400. That's 3 times more than our environment can sustain. Killing the burros isn't an option because it's illegal. But in a moment of frustration, one official suggested such a step.
I don't want to shoot the burros. Nobody does. But it takes that sort of rhetoric to get attention sometimes from the outlying areas.
Moss said he was glad to start a conversation, but that long term, there needs to be a better solution.
It's basically the Dutch boy putting his finger in the dam and hoping he can stop it from bursting. But it's a start. It's a Band-Aid, but it's a start.
In Washington, Katie Beery, Cronkite News.
The controversial plan to mine copper near Oak Flat is back in the news. This time from opponents of a plan to have Oak Flat declared a historic place. Cronkite News reporter Samantha Witherwax has the story from our Washington bureau.
Arizona Representatives Ann Kirkpatrick and Paul Gosar wrote this letter to the National Park Services asking that the historic designation be withdrawn. Park Service officials said that they couldn't do that, but they could extend the comment period until Friday, giving the lawmakers a few more days to make their case. It's the latest twist in a fight over Oak Flat, the site of a proposed copper mine that members of the San Carlos Apache tribe say is sacred to them. They occupied the site last February, saying,
Our connection to the land makes us, it's part of something that greatly makes us who we are.
But supporters of the proposed resolution copper mine say it's an opportunity to bring thousands of jobs and billions of dollars of economic activity to southeast Arizona for decades to come. Gosar and Kirkpatrick said they're concerned the historic listing is an attempt by mine opponents to undermine our bipartisan bill that is estimated to create approximately 3,700 new jobs. A statement from Resolution Copper said the site can be protected without historic designation through a thorough environmental review.
We believe that the most appropriate way to ensure that this matter is fully evaluated is through a comprehensive NEPA process that involves all stakeholders.
NEPA stands for the National Environmental Protection Act, but Representative Grijalva says the site deserves more than that. Oak Flat is an important cultural and religious area that is vital to the traditions of our Native American brothers and sisters. It deserves our strongest protection. We were not able to reach Apache Stronghold, the group that has been leading the fight to protect Oak Flat, but officials with the National Park Services say that they expect to have a decision on the historic designations by the end of the day on Friday. Live in Washington, Samantha Witherwax, Cronkite News.
For the first time here in the Valley, a plastic surgeon will be using new 3D printing technology in reconstructive surgery. Cronkite News reporter Lauren Michaels met with a patient and doctor to find out how this technology works.
It's probably a parent's worst nightmare for their child to end up at a trauma center like this one. But for an 18-year-old, his road to recovery has been quite unique.
I just wasn't paying attention, ran across the street.
Jake Reynolds was hit by a car going about 25 to 30 miles an hour past this park in Glendale.
And from there, I just pretty much blacked out.
He was rushed to John C. Lincoln Trauma Center. Reynolds says he's lucky that Dr. Pritchard was on the floor that day.
His face was pretty devastated. This area along his face, all of the bone was just crushed.
Reynolds has already had more than 3 reconstructive surgeries using metal plates and screws, and he has one more to go. It will be the first of its kind using 3D printing technology from a CAT scan.
The 3D technology came out, and we started using mirror images of the opposite side of the skull, and then a mirror image implant can be developed to fit exactly, as you can see, in that bony defect.
And Reynolds is thankful his doctor is up to date with the latest technology.
There's just tons out there for me, and if this was to happen, I don't know, 20 years ago, and it's just 20 years, and I'm sure I would not look nearly as good as I do now.
And the final surgery is scheduled for June, and Dr. Pritchard believes once other doctors see the positive results, this 3D printing technology will just become another popular tool in the medical field. Here in Phoenix, I'm Lauren Michaels, Cronkite News.
Arizona McDonald's has brewed up a new program to reduce their waste by 30 pounds each day and help local schools. Elena Mendoza tells us more about their newest recycling initiative.
Gives it hyperness caffeine so it can bounce up and grow.
Kids and coffee normally don't go hand in hand, but at Madison-Simus Elementary School, it's a key part of the curriculum.
I like coming out to the garden because I like helping the plants, seeing how they sprout.
DIGS, which stands for Discoveries Growing Gardens at Simus, has been a hands-on science-based gardening program at the school for 17 years. With the help of McDonald's, the school doesn't have to pay for or struggle to find coffee grounds for their gardens any longer.
The McCafe Gardens Growth program is amazing for us because we've in the past had to hunt down where we're going to get our coffee grounds from.
Madison-Simus is one of 130 schools across the state that has partnered with McDonald's to recycle their used coffee grounds.
Arizona schools participating in the McCafe School Gardens Grow program expect to divert thousands of pounds of waste from going into the waste stream.
Nationally, McDonald's has a Good Neighbor, Good Grounds program. Arizona restaurants are the first to partner with the Department of Education.
The average McDonald's produces 30 pounds of coffee grounds every day, 11,000 pounds of coffee grounds a year. And how can we keep that out of the landfills? Well, we can give it to the schools.
It's a win-win situation. It's beneficial to the environment and it makes learning fun for the students.
And just learning about how we plant.
In Phoenix, Elena Mendoza, Cronkite News.
McDonald's plans to begin a similar program later this year so customers can get used to the grounds for their gardens too.
Now, here's an @Cronkite News Pick of the Week, a favorite from the Cronkite News staff.
For patients far from their care providers, traveling to receive the care they need is not always easy. For patients with life-threatening illnesses, long-distance travel can be detrimental toward their health. Chloe Norquist has how a volunteer-based pilot program is helping the medical patients get from their home to the doctor's office.
Hundreds of pilots across the western United States volunteer their time to help those who need a ride, including longtime pilot Dennis Phelan of Goodyear.
We're going to fly a mission today where we're going to go over and pick up a husband and wife team and bring them back here to Goodyear so he can participate in his cancer treatments.
Dennis Phelan is a volunteer pilot for Angel Flight West, an organization that flies patients from their hometown to where they need to go.
We do a wonderful service for people.
A plane like this Piper Seneca 2 can take pilots like Dennis over 700 miles to pick up patients across bordering states.
Today, Phelan is flying to the rural town of Daggett, California to pick up George Eastless and his wife. George is being treated for stage 4 cancer.
I live just right here in Barstow, so we get on the plane here in Daggett, and boom, we're there at Goodyear. And
According to George's wife, driving to Arizona takes too much of a toll on his body. On this trip, Eastlis will be undergoing chemo and radiation on 3 tumors.
we're blessed to have him pick us up, drop us off. It's right there, you know. I couldn't ask for anything closer. God's blessed us for that.
Phelan has been with Angel Flight for 6 years now and continues doing what he does because of the satisfaction he receives from transporting patients like George.
It's so rewarding. I would encourage as many people, if they have an interest, it's so much better than the $100 or $200 hamburger. You'll get a lot more satisfaction out of doing something like this.
And that's what makes it all worth it to Phelan. In 2015, volunteer pilots made over 4,000 trips across 13 different states. The organization is based in Southern California and has been in operation since the 1980s. In downtown Phoenix, Chloe Nordquist, Cronkite News.
Cronkite News tracks your likes, tweets, and shares from all our social sites to bring you this news special. At Cronkite News, our weekly refresh. Join the conversation so you choose the news. Like us on Facebook, follow us on Twitter, subscribe to us on YouTube, and log on to cronkitenews.azpbs.org for top Arizona stories anytime.
Become a news source for the Arizona PBS Public Insight Network. Your ideas and insights can help us create relevant and distinctive reporting. Join now at azpbs.org/pin. 8 is Arizona PBS, a service of Arizona State University.